Whakamonu me whakatulau ke matua he langi ko mai ke dautolu ke liu ke whakalataha mai ke he lalo whakamalu nai. Whakalawhalahi atu ke he hadautolu to matakainanga ke he mangaho pale la whiawhinai. Before we make an official start, if I can ask everyone please to shuffle forward, if you can come forward, and we would like to see everyone be seated before we start whakawelahi. Like any other cultural event or a Pacific event, we always start with a blessing. May I ask Vicar Reverend Ingasia Tamamukule from the Holy Trinity Anglican Church in Otahuhu to bless this event and also to begin with the opening prayer. Whakawelahi.
I was told recently we're doing what we do best is to acknowledge our Heavenly Father for the grace that He has given us. And there's a saying goes, put God first and everything else will be history. I don't know, you can interpret that one in your own way. Because I know behind God, we have to work hard for it. So on that note, tuki mohu, tuki mohu, tuki mohu, mohu, mohu. Tuki mohu is a hiccup in my Niue context. So when we got a hiccup, we straight away bound our chest. That's one option. And the other option is we drink water to calm the bounding of our heart. So I would like to open with the creation story. I give you creation story because I know you're not going to remember Genesis chapter 1. So I'll give you the creation story. So you type up creation story and all it comes up. The creation story, we all know about it, that God created heaven and earth. And in the beginning, then He saw it was so beautiful the first day. Then He moved on strength by strength. The next day, He created even more. And He really enjoyed what He done. So I'll leave you on that note, but I'll open with the Niuean blessing. Kia mui totolo. Kia mui hohoko. Which means, may it strive satisfactory. May it live continuously. Riongia dautolo. Let us pray. Ha mautolo aiki, ha mautolo a matua. Fuhiulu au loa a mautolo ke he tapu he lilifu he hawa hingoa me hawa puletonu. Ke fui mai e moui hohoko, moi moui totolo, ke ponata ki aki e mata kaunai. Kia ofa he pulotu moi loto matala. Malau tolu kua ofa nia e koi. Ke moua e uhi, he potaanga he mui. We gathered here in your presence, O God, our Father, and petitioned your holiness of power to abundantly give life to this new initiative the wisdom and knowledge, to those that you have called to lead, and to those who in need. May the wealth of information brings the goodness out of us. May we beat creatively. May it beat innovatively. May it beat constructively. Ke he hawa ofa he ofa nianga. Tākina mai. Kia mui to tolo ko e tua. Kua pona ta kiake e mautolu e awhia whinei. Monu, monu, monu si tonu. Shoo-hoo-hoo. May our pathway forward with God's blessing. Amen.
Whakawelahi o Itulutulo, ngā mihi, and thank you, Reverend Inga Siatama Mokole from Holy Trinity Anglican Church in Otahuhu. I would like to invite Hemidale, Director of Māori Medium Education School of Te Punawananga, for his mihi whakatau.
Korohi pō, korohi ao, korongo I tūre ki te matahau o tū te wini, tū te wana, tū I hakaputaina ki te whai ao ki te ao mārama ti he Māori ora. E tau nei ki rungi a tātou katoa te wairu o ngā tūpuna, nā rātau I whakatakato te ara hei hiko inga mā tātou ngā uri. Whakatōki o tātou ngā kau ki ngā tikanga e hāpai ti atu ai a tātou mahi katoa I roto I te tika, te pono, me te aroha no tētahi ki tētahi. Tūturu whakamaua kia tīna, haumi e, hui e. Kia ora tātou. Hoi nora, te mihi tuatahi māku ki tō tātou rangatira ki a koe e te minita nā ura tātou I whakarite I te timatanga o tā tātou nei hui. Nā hoki tā tātou arawhata ki te wāhi ngaro I whakatū. E tau iho ai ana manaakitanga ki rungi a tātou e hui nei tēnei haro te ahiahi. Nā re mihi ana, tēnā rawa atu koe. Tuarua, kei te hui tātou ki roto I tō tātou whare, me ki nei ki raro I tana tuanui, ki wainganui pū o te rohe o Ngāti Whātua, nā re tika ana kia mihia a Ngāti Whātua tangata, Ngāti Whātua iwi, kua roa nei e tūtaki nei I te ahi kāro o tēnei kāinga. Nā, e ki ana hoki te kōrero, he huihuinga tangata, he hokinga mahara, he hekinga roimata. Nā reira e tika ana kia mihia, kia tangihia, kia poropora ki tia rātou te hunga kua ngaro I wainganui a tātou, me ki nei o tātou mate huhua o te wā nei. Nā mate kei te pīkauri e koutou I tēnei wā, kia mihia, kia tangihia, kia poropora ki tia rātou katoa. Tukuna rātou kia moe I tā rātou moenga roa, rātou kia rātou, āpiti hono, tātai hono, rātou te hunga wairua kia rātou, āpiti hono, tātai hono, tātou te hunga ora kia tātou, tātou e tau nei I raro I te tūnu o tō tātou nei whare, tēnā koutou, tēnā tātou katoa. Hoi nora e mihi ana kia tātou katoa, me ki nei ngā kai whakahari o tēnei huihuinga e whakarewa hi ai te pūtahi rangahau e kia nei ara Centre for Pacific and Global Health, hoi no taku aronga ki te ingoa Māori nei, te Poutoko Ora a Kiwa. Nā reira, Sir Colin e tikana ki a mihi atau ki a koe, nā ura tēnei kaupapa I kōkiri ki tōna mutunga, me taku ki ake te whakapātuatahi ko taku whanaunga pāpārangi. O taihu aku kōrero mōna I tēnei wā, parhono, mihi ana ki a koe o tira tō rahi I kōkiri I tēnei kaupapa. Kāre e kumiroatia ngā kōrero, e hari te mea he nohi no te aroha ki a koutou ka hore, engari he nui ngā kaupapa I roto I tēnei huihuinga, nā reira ka poto te kakau o te paipa I tēnei wā. Sir Colin, Reverend, esteemed guests, friends, whānau, whanaunga, supporters, tātou katoa e hui nei. I just want to take this opportunity to welcome you all here at the beginning and acknowledge the honour that I've been given to do that. This is also the opportunity for me just to talk a little bit about the name Te Poutoko Ora Kiwa, just to give some context to the name there. And so I'll start just by saying towards the end of last year, Paparangi, who's not here today, he's in America as I understand it, approached me and we both come from the same tribal group, Te Rarawa in the far north, and she kind of made me an offer I couldn't refuse. I think if I'd refused it, it could have meant excommunication from our tribe, but anyway, we won't go there. But that set in motion a discussion with Sir Colin and the team there in terms of getting some sense around what the work of this research centre is focused on, and so generated some names as a result, and ultimately Sir Colin and the team decided on the name we see all around us here today, Te Poutoko Ora Kiwa. And so just to let you know, the word Poutoko means to leader or to lead, and so in the phrase Poutoko Ora, we're talking about the focus on leadership in regard to health, vitality and well-being, given Ora sort of encompasses all of those things. The addition of the name Kiwa makes a deliberate connection to Te Moana Nui a Kiwa, the Pacific Ocean, ngā mautere o Te Moana Nui a Kiwa, all of the various Pacific Island nations, including Aotearoa, lest we forget our location here in the Pacific. Conceptually in the name, there are notions of whakapapa, whanaungatanga, relationships, shared connection over time, as well as a focus on the future, which is part of the mix as well. And so, by way of explanation, that is what's behind the whakapapa of the name there. I'm just going to... Somebody might be thinking, it's a Māori name and it's a Pacific focus here. That might be another discussion. Colin and I had a quick offline discussion there, so I'm going to deflect any response there in relation to that, just to say that I think I've done my part in that regard there. And he's got very broad shoulders. You don't get knighted for not having broad shoulders. Just to complete this part of the process, though, we have a tradition, a Māori customary tradition, about naming, and it's kind of seeking your affirmation in regard to the name. So I'm going to ask you a question, and the question is, Kuai te ingo tēnei rōpū? What's the name of this group? Okay, and the response I'm after is Te Poutoko Ora a Kiwa. Okay, so I'm going to ask you a couple of times. If I'm not happy with the sort of the volume level there, I could go a third time there. We shall see. So in order to bring the name to life, Kuai te ingo te rōpū? Kuai te ingo te rōpū? Kuai te ingo te rōpū? Ka pai kua tau. We've settled that. Tēnā koutou, tēnā koutou, tēnā tātou katoa. Te aroha, te whakapono, me te rangi mai e, tātou tātou e. Te aroha, te whakapono, tātou katoa.
Thank you, Hemi. So I'm going to ask the question in English. What is the name of the Centre for Pacific and Global Health? Sorry, I'm going to ask you again. What's the name of the Centre for Pacific and Global Health that we're launching today? Thank you. That was 6 out of 10. Moving on. So firstly, my name is Lynn Lolokini Kimotupavihi. I am your MC for this afternoon. I hail from the beautiful island, the capital of Polynesia, Niue Island. If you've never been to Niue, Sir Colin can tell you all about it. I want to acknowledge all our invited guests. Everyone, you've given up your time to be with us today. Today is a big celebration, not just for Auckland University, not just for Auckland, not just for New Zealand, but for the Pacific regions, globally, internationally. So it's a big celebration. I want to acknowledge our families and friends and colleagues who are streaming live, who are viewing, who are joining us virtually online. Whakalofalahi atu. Okay, a few housekeeping rules. So, this kaina is smoke-free and vape-free, inside and around the whale. Smoking areas are on Grafton Road, at the end of Winnan Street, where the barrier is. Clean and green, no littering. Rubbish is to be put away into the bins outside the whale kitchen. Bathroom allocations. Through the door to the whale kitchen area to the left, women's first and men's at the far end of the hallway. In case of a fire emergency, where Sir Colin goes, you follow. The whale crew will evacuate everyone inside the office spaces and underground car park, whereas please, you need to move away from this whale and listen and follow the whale crew. They will direct everyone out of Owen Glen if emergencies escalate. Now I'm going to introduce Sir Colin Tukuitonga, a proud fuata tangata toa niue, niue born, New Zealand doctor and public health academic, public policy expert and advocate for reducing health inequities of Māori and Pasifika people. He has held several positions in public health and government in New Zealand and internationally. His current positions at the University of Auckland are Associate Dean Pacific, Faculty of Medical and Health Sciences, Associate Professor of Population and Health, and Co-Director for Te Poutoko Ora a Kiwa, Centre for Pacific and Global Health. And also to add on to that, a very strong advocate for Wangahau Niue language and culture. Pasi pasi mai, let's give Sir Colin a big round of applause.
Whakalofalahi atu lilipu he whare talofa lava, malo e lelei kia ora ana Nissan Bulavinak, malo ni kia ora koutou, it's a pleasure to be here. Inga whakalofalahi atu, whakaue e leongi he whangi whono tōtoro, moi whakalilifu e whakapotoanga he awhiawhi, whakalofalahi atu. Hemi, wonderful, thank you for that explanation, and of course for gifting us with the name. You know, you will be forever be connected to the centre. So this is a fair warning. If we're going to run short of money, we're going to come. We're going to come find you in Paparangi. But seriously, I think it's just been tremendous to have you with us. Dean, John, Fraser and Warwick, Philippa and the colleagues from the faculty, thank you for being here. Dr. Levasar, thank you for your presence, and your colleague Teresa, who are with us today. The Deputy Prime Minister and others are on a tiki tour around the Pacific, so I said to Levasar that we draw the short straw. We're here. Well, I think today they're in Suva. They were in the Solomon Islands and en route to Tonga. So thank you for being here and joining us today. Ladies and gentlemen, all of you here, we really appreciate your time. When you start something new like this, of course, we've heard many centres that go to the wall not long after they are found, and very few succeed. So it's a challenge, and we don't underestimate the challenge before us. But more importantly, of course, the figures and the statistics behind that. And I'd like to think that this is our small effort, our meaning faculty, towards better understanding the challenges that we have. Not to describe, yet again, more problems, but to work with various communities to try and find some solutions. I think it's unacceptable, the inequities that we see in our country, not just for Pasifika people, but for Māori as well. I think it's terrible, actually. We have all the resources, we have all the knowledge, and yet disappointing. The other thing I should say, of course, is that this is not just for Pasifika people in Aotearoa, New Zealand, but cousins, whānau, who remain in the islands. And you'll hear more later on this afternoon about some of the projects that we've undertaken. So it's really just a short acknowledgement from me to all of you for making the time to join us. If you hear not good things, don't spread it. Talk to us, ask us. If you hear good things, celebrate it and shout it from the rooftops. It's always hard when you're the little guy trying to change things. So help us. This is for all of us. I just want to finish off with a statement from a very famous New Zealander, a certain Right Honourable Jacinda Ardern. She's written this note that I will share with you. Malo e lelei talofa lava, taloha ni ki o rana whakalofa lahi atu. She's Niuean, of course, ni Sambula, and kia ora koutou katoa. It was such a pleasure to receive an invitation to join you today, and while I am saddened that I am not physically present, please know I am celebrating with you in spirit. But I'm not the only one who will be celebrating. What today represents is a great leap forward in the necessary work to ensure our Pacific communities have the health and well-being they deserve, and that we face the healthcare challenges of the future. Important to its success is its foundations, and the foundations for Te Poutoko Ora a Kiwa, directed by Sir Colin Tukuitonga, Dr. Judith McCall, Professor Judith McCall, and Dr. Rowanne Ngashu, and with former Director General of Health, Professor Ashley Bloomfield, as Chair of the Advisory Board, are not only strong, they are formidable. You have the wonderful Anai with you today, and so it falls for me to simply give a word of thanks. While there is much to do, you have already reached a milestone worth celebrating. What you have created is a first. May you create many more in your endeavour to better serve our communities and our region. Ngā mihi nui, and my kindest regards and best wishes. Jacinda Ardern, a humble resident of Sandringham. Ladies and gentlemen, thank you very much.
Oitulo, Lilifu Sir Colin Tukuitonga. I have the honour in inviting Dr. Anai Neru Levasa, Member of Parliament, as our next guest speaker. Dr. Anai Neru Levasa is a passionate, hardworking advocate and has served as the inaugural Member of Parliament for Takanini. He has lived in South Auckland for over 30 years. He is married and has 2 young children. After surviving metastatic bone cancer, Dr. Anai was inspired to train as a specialist GP to provide support to his community. He graduated from the University of Auckland Medical School and became a fellow of the Royal New Zealand College of GPs. Dr. Anai is a keen humanitarian, having been posted on 2 assignments in the Pacific with both the Red Cross and a Doctors Worldwide volunteer organisation. He has also served in rural farming communities as a general practitioner. Welcome, Dr. Anai. Pasipasi mai.
Kia ora koutou katoa, malo lelei, kia ora ana, malo ni, pulawanaka, whakalowhalai atu, whakatalofa atu, Māori, a malo lava suifu maua malenlangi a mama, whaftai lo sunga le whawhia ngainga, Reverend Inga, sia tama mo kole, whaftai mo le whapa ia ina o tātou fufuanga le nei aso, mo moana si ia le vi inga le atua o na taunu manuia le nei wha moi moi. Thank you, Reverend, for your blessing today, and thank our Heavenly Father for the blessings as well. Good afternoon, distinguished guests, ladies and gentlemen. I am so honoured to be speaking on behalf of myself, but also the Minister, Barbara Edmonds, Minister of Pacific Peoples, and also Associate Minister of Health. She's given me this great privilege, delegated me this privilege to attend and launch Te Poutoko Ora Kiwa, University of Auckland Research Centre for Pacific and Global Health on her behalf. I would like to start by thanking the directors of Te Poutoko Ora Kiwa, Associate Professor Sir Colin Tukitonga, Dr. Judith McCool, Dr. Raini Shiu, for the opportunity to celebrate this launch with you today. I would also like to acknowledge the work that Dr. Sir Ashley Bloomfield, who unfortunately cannot be here, his work has been an integral part of this centre as the governing council. I'd also like to acknowledge other representatives that are here as well. I see my colleague, Teresa Ngobi, MP for Otaki. She's always waving the flag for Otaki. Thank you, sis, for being here. Also, the many other doctors that I grew up with before I was a medical professional myself, Dr. Debbie Ryan, Dr. Tamalai Sau Suali, Dr. Aniva Lawrence, my GP colleague as well. The faculty that are here as well. Thank you. Haven't seen you in a long time. I'm the class of 2008. I was probably the naughty one right at the back. But hey, we've made our parts, and it's great to be here. I often get teased by my medical colleagues. What are you doing moonlighting as a politician? We need you down on the ground, doing the mahi. I still practice as a GP when I can. I try to squeeze in clinical time. But I'm so proud to be representing Takanini in South Auckland and advocating on Pacific issues as well. I want to acknowledge the name Te Poutoko Ora Kiwa gifted by the directors, and I acknowledge Hemi, Dale, for your work. And I just want to reiterate the name because there is always a meaning in the name, whether biblically, I know us Pacific were named a certain name because it has a huge weightiness of it. So I just want to again acknowledge that the word Potoka means leader. At the Ora indicates focus on leadership around health, vitality, and well-being. The addition of Kiwa, making a connection to Te Moana Nui a Kiwa, our Pacific Ocean. So again, the concept of legacy, whanongatanga, as you've mentioned, Dale. The shared connection and whakapapa with ngā mautere o Te Moana Kiwa, including as well Aotearoa, New Zealand. So thank you, Hemi, for gifting that name. It's great to be back in Whale Pasifika, but also on university grounds as a former student of Auckland Medical School, now a Pacific Health advocate and a member of the global health community. It is a pleasure to be here. There's lots of good memories, lots of not so good memories in terms of all the exams we had to face. But the good memories for me is that not only did it launch my medical career, but in this whale in which we all sit in is where it also launched my marriage as well. So I got married here. This whale was opened, I think, in 2004. I was the second wedding here back then as well. So I'm still married, so this place represents relationships, commitment. But again, Te Poutoko Ora Kiwa's mission is one that is close to my heart, addressing inequities in Pacific and global health through innovative service and research. And as a clinician, we need good research to inform evidence-based practice, best practice to serve our people. And it is inspiring to hear the story's inception from Sir Colin, Dale, and the work behind the scenes, the importance of building pathways for leaders to strengthen the health, vitality, and well-being of all our communities. We all need to be in places and positions to influence and improve the health and well-being of our people. Equitable outcomes by having equitable representation across the board. This university has and will continue to grow Pacific leaders in research, practice, policy, government, and wherever you've been called to improve the outcomes of our people. I know that Te Poutoko Ora Kiwa will work collaboratively to design and deliver solutions to the Pacific's region's most pressing challenges, whether it be non-communicable diseases, NCDs, the health impact of the climate crisis, pandemic preparedness, the health of children, our tamariki, young people. Key priorities I see for the centre will be promoting Pacific values, priorities, knowledge, drawing on our indigenous frameworks such as talanoa and wayfinding, mātauranga Māori, epidemiology, clinical medicine, and so forth. Because we all know we're all tied to our homelands in the Pacific. That's why this centre is focused on the Pacific region. When the tsunami happened back in Samoa, or the measles happened, I know many of us dropped everything and we went back to the islands, whether it be the Tonga disaster that happened as well. Our Tongan clinicians, pretty much everyone, whether you're Tongan, Samoan, we all rallied together to go back to the homeland to serve our people. And that's why, that's how we roll as Pacific peoples, right? We're always thinking about our homelands back there. Climate change is one of the most pressing public health challenges and threats of our time. And health-related climate crisis will further test the resilience of our Pacific health systems. And this is more so in the wake of COVID-19 and amidst the ongoing burden of NCDs as well. And I know the centre will commit to drawing on Pacific values and again that indigenous knowledge in order to design and deliver the solutions for our people. I know I'm going really on focusing on the centre's model, and I just want to make sure that people understand where the centre is well positioned to do so. And they will operate in a co-creation model with scholars, students, and partners from government, non-government, regional, global organisations contributing to its mahi. In closing, I would just like to commend Te Poutoko Ora Kiwa's community for its commitment to upholding the rights of Pacific peoples and elevating Pacific research and capacity within the region. Research that is, one, inclusive, but also culturally sensitive. That is what is needed to fulfill our collective aspiration for better health outcomes in the Pacific region and beyond. Whawhatai Lava, thank you for having me to be part of this historic occasion. I am very proud to be one of your medical colleagues, and I also as a Pacific MP, to advocate on Pacific issues. I wish the centre every success in its future endeavours and look forward to following Te Poutoko Ora Kiwa's growth and its members' innovation and collaborative ways of working. I guess this is where I say I hereby, and also on behalf of the Minister Barbara Edmonds, declare the centre open. So I fō mai e manuia.
Whakawelahi Lilifu, Dr. Anai Leavasa. Our next keynote speaker was the former Director General of Health and inaugural chair of the Centre Governing Council. Unfortunately, he is unable to attend in person today. However, he has provided an address. Pasi mai, let's give a big round of applause for Professor Sir Ashley Bloomfield.
Ora koutou katoa, warm Pacific greetings. I'm thrilled to be able to be with you remotely at the launch of Te Poutoko Ora Kiwa. I'm very sorry I can't be there in person. I'm across the other side of the world today, working on the international health regulations at the WHO in Geneva. And one of the things about that is it's wonderful to see countries coming together to act in solidarity and to think about how we can protect populations globally better. It's wonderful to be part of the new Pacific and Global Health Research Centre. And I'm really pleased to be involved in this new role as chair of the board. And it's a key part of my new role at the university. So it's lovely to be back among friends and colleagues and able to take this role on. I'm really looking forward to the opportunity of working with all of you to strengthen research, both in the Pacific and of course in Aotearoa, New Zealand, that will benefit our communities in New Zealand and across the Pacific. One of my other roles in the university is helping establish what's called a Public Policy Impact Institute. And the key word there is impact. All our research should be impactful first and foremost. It should be meaningful for the public, for our communities. And therefore, it needs to be informed by, it needs to be relevant to, and it needs to be able to be used by our communities. It needs to be, in short, a partnership effort. So I'm excited about the prospect of this research centre and what it might bring to strengthening the partnership the university and others will have with our communities, so our research is more useful and able to really impact on the lives and well-being of our communities, both in Aotearoa and across the Pacific. I'm looking forward on the board to working with many esteemed colleagues from across the country and the wider Pacific. And I know they will be deeply committed to ensuring this venture is successful and to working in partnership with our community and their communities. I'm going to ensure that the reality of partnership is there from the start. And I know both Colin and Judith will be committed to that as well. So thank you again to all of you for coming to this launch, for supporting this new venture. I look forward to working with you and indeed seeing you all in person. Kia ora koutou katoa.
Lilifu Professor Sir Ashley Bloomfield. Okay, so we're going to have a little short break. 2 minutes, 2 minutes, 1 minute 59 seconds. While we've got two beautiful ladies who will be giving us a short dance entertainment performance. So this little short break, if I can ask for you to talk to someone next to you or get up and go and get yourself a cup of tea or go for a little toilet break. Yeah, so if you can do that. I'm counting 158. So for those people who wants to know something funny, I'll tell you a little joke. In Niue at the moment, there are only 2 types of 4-legged animals. Who knows what those 2 types of 4-legged animals are that are currently in the island of Niue? Anyone? Yeah. Dogs. And the other one? Cats? Yes. One more. We consume them. Puaka. There we go, 3. So in Niue, we don't have cows. That's why Niueans don't know how to go moo, you know. We don't have cows, we don't have goats, we don't have sheep, we don't have lambs, but we love to consume all the meat from those animals. 1:30. Okay, 30 seconds. Come on. I'm going to use my teacher voice. By the time I get to 1, everyone is seated. Hmm? 10 seconds. I have to say that this has been an amazing event. We start on time. We're actually on time. We're doing well. Yeah, I'm talking just to try and get everyone's attention. 5 seconds. I know. I'm sorry. I know we've got lots to share. Oh, thank you. Oh, you people are amazing. Well done. Okay, so we have got a performance from two beautiful women. Lahaina is in her final year at the best university in the world, University of Auckland, studying a Bachelor of Arts and Bachelor of Laws conjoined. And Natalie graduated from the best university in the world, Auckland University, in 2018 with a Masters of Arts in Pacific Studies. Both are core dancers of the all-female collective Uradapu Pacific Dance and continue to share their passion for their culture and people through koli. Pasi pasi mai, let's give them a big round of applause. Woohoo!
Mua, sorry. Ah. Mua, mua, ia, mua, oh. Sorry.
oi tai pole momila me novel poli ulila oi tai pole momila me novel poli ulila mai oi a honi tai gula mai gula lena e na lo awane ila uli mai oi a honi tai gula mai gula lena e na lo awane ila la la lima papa ai taponola e kanu kui ke kapa mo e holula la la lima papa ai taponola hao e kanu kui ke kapa mo e holula walomi lomi ia amigo kailila anu tahawa apau pau wahola lomi lomi ia amigo kailila anu tahawa apau pau wahola kaina ia makana takuanala kaua oalana manula kaina ia makana takuanala kaua no make noise la
Somebody give Elton Saba! Oh, yes! Elton Morgan's still alive!
All right, Captain. The man. Love himself.
Okay, yeah.
Well done. Okay. I would like to introduce our next speaker, Dr. Rowanne Nishu. She's the coordinator, co-director, my apologies, with Te Poutoko Ora, a Kiwa, and a senior research fellow at the University of Auckland. Rowanne has 15 years experience in human geography and Pacific health, education and development. Rowanne is Samoan and was raised in South Auckland and graduated from the University of Auckland with a PhD in community health. Pasi pasi mai, let's give Dr. Rowanne Nishu a big round of applause.
Malo lava soifua manuia, malangi ma. Welcome everybody. I'm a little bit overwhelmed today, mostly because we've been working really hard behind the scenes, and I just want to thank the team for putting this on. It is amazing. Colin, you know, as usual, sits back and is make it happen. So thank you, team. No, Colin's the heavy hitter who brings everyone together. I also was sitting and reflecting that when I was doing my PhD, Doctor and I was studying, and he actually helped me a lot with my PhD. And it's amazing that 2 Samoan kids from South Auckland turning up on stage and launching this inaugural Centre for Pacific and Global Health, Te Poutoko Ora Kiwa. So I thought I just might indulge everybody a little minute while I mused about that. But I guess for us, and as Sue Colin had mentioned, lots of centres launch and then they kind of go bust. But for us, we've been actually working really hard for the last 18 months, or since I got here in July 2021. But this is a brainchild that was of Sue Collins, but also of Associate Professor Judith McCall. They just brought on a third wheel, me, to kind of help to rally the troops together, I guess bring the young ones together. So as our first year, these are kind of our research and innovation areas that we're currently working on. So shortly you'll hear, I guess, a snapshot from some of our partners that we're working with in order to bring Pacific solutions to Pacific problems. Things in order to help us to rise to meet the challenges that our society is facing, to amplify the solutions that are within us, to help not only our Pacific region, but also the world. So we've shown as Pacific people that we can be leaders in climate change. We can do that in health too. These are also all our partners that we're working with and our funders. So we've got a few global projects working with the Atlantic Countdown and CAP 2030. So CAP 2030 is Children in All Policies by 2030, and we're looking at building resilience for young people. So resilience is something that is thrown around a lot, but from a Pacific perspective, we don't know. But what we've argued for a long time is that our Pacific young people are resilient. They've had to be. So what can we learn from them to share with other young people across the world? I'm not going to do a lot of talking, but I guess my main point to wrap up is that if you want your pretty logo on our flashboard, if you want to partner up and help to do some $1 million, we might have to have an auction night later on, then yeah, please reach out. For us, this whole centre is about partnership, as Sue Colin and Sue Ashley had said. It's about making sure that we work together with everyone, from our mamas and our papas to our young people, from our communities, from very smart people. So we've got, as we've said, Sir Ashley Bloomfield running our governing board. We've got technical advisory committees, but there's a lot of knowledge within our communities, and we just want to give you an opportunity to work together, to bring that to us, and yeah, let's do some cool things. Cool things like, and I'm going to hand it over to Sir George Toitama from the Ministry of Health in Samoa, who's been our partner on the Pacific Mental Health Program, funded by the Polynesian Health Corridors.
Ora, my name is Seiuliari'i Dr. George Usofono Leo Toitama. So I'm currently looking after the mental health services here in Samoa as the head of department. So we have a mental health service or psychiatric service in which we have inpatients, outpatients, and also for our step-down service and our community service. So we currently look after a population of about 200,000 people of all the main islands. We're working very closely with the district hospitals and also with the hospitals and the other islands, just to ensure the ongoing care of our patients and also the ongoing management of our patients. So we work closely as well with NGOs, and one of the NGOs, which is Goshen at Momoa, is currently helping look after a rehabilitation center, which is like an off-site ward. So a little bit of the project, as you know, that I was one of the key clinicians and also a co-investigator for the project that was recently done here in Samoa, which is the Pacific Mental Health Survey, or the Samoan Mental Health Survey. So this is the determination of the prevalence of physiological distress and symptoms of mental disorders amongst the general population. One of the second part is actually to measure the severity of psychological distress and symptoms of mental disorders, including functional impairment. Now, why is this project important? Pacific people have managed their well-being and mental health on their own, or with the help of their family, churches, or the villages. However, for many years, those of us who work in health have recognized that we don't know well enough the extent and nature of mental health disorders around the region, are working to change that. We are building the evidence base to understand what exactly is happening, and in the process, we have been blessed to upskill our own workforce. So what was the role like in Samoa? So it required co-creation and collaboration with the team in New Zealand. So our local communities and ministries understand the importance of mental health and gathering quality data. So they were all mobilized and committed to this project. They worked tirelessly, and it was clear that there is a keen interest and passion to serve our villages and families in the health and well-being space. We were able to lead much of the rollout, and there was a high trust between us and the center because we were understood to be expert of the context, which is the culture, the community, and as a result, we managed to get a fantastic spread across the islands, the villages, and a diverse range of participants. So we were pleased with the great reception across the ministries and the people here in Samoa. We need research where we are included at all levels, from design to dissemination, and this has been a case where we were coordinated. Effort has been made to move together at the speed of trust, and the support of capacity and capability has been very key. So what were the key learnings is partnering with us in the region requires the humility to understand that we have our own ways of working and engaging with our people. It may take time to decipher it, but at the core, it has been our Samoan and Pacific values, which the center keep at the forefront of their work and we have experienced that firsthand. Regarding the rollout, our people are often considered hard to reach, and that was not at all the case with us. We had so much interest and turnouts every day, with the participants coming in for our questionnaires and to be part of our survey. It would be a shame to halt or end this work. This needs to be the beginning, and ongoing efforts and research needs to be committed to in the Samoan region so that our solutions are informed by more real-time or near real-time data. Authentic partnership is key, not just the tick boxes, but really having us to co-create at all stages, and a seat for us at the table, which is the beginning, the mid-phase, and also towards the analysis, with inclusive participation ongoing, which we have managed to foster as investigators. Challenges? Well, one of the main challenges is that there continues to be a need of resources. And it's not just human resource, financial resource, knowledge-based resources like the expertise, and especially relationships and the coordination and support from our partners with expertise in this area of research and also on mental health. But however, this is a great start. So once the data is finalized, and then what? Well, we need to advocate, increase investment, start building mental health services in Samoa, and continue to gather research and evidence to ensure better quality of healthcare to address the mental health needs across all the generations. When we carried out the research, it was such a heartfelt experience in going out and building the relationship with the patients. Although we were there to get the questionnaire, I always have this comment about mental health, and that, you know, when you're dealing with people with mental illnesses and mental health issues, you don't just deal with the mental health issue. You don't just deal with the issue, the illness. You have to help the person. It's not like other areas of the hospital in which you come in, you know, you have a cut in your hand, you've got the flu, you've got the runny nose, and you deal with just that illness. With mental health and psychiatric work, you need not just to deal and focus your energy and your help towards that illness. You have to understand the person. You can never deal with a mental health issue without understanding the person and looking at the person overall. So what encapsulates a person's overall well-being is not just their physical health, it's their mental health, their spiritual health, their social health. All these things need to be taken into consideration. Doing this research and carrying out this research has actually enabled us to understand more of the mental health needs and the mental health issues here within our people and within our country. And in saying that, it's just a reminder for us that we actually need to do more of this. A lot of what we're learning of is researchers from other countries, is the experience from other places and other areas. But we don't have any at all published evidence of the experiences that we have with our own people. And I keep saying this as well, that when it comes to mental health, everyone is unique. Everyone is different. And we can't have an overall view of things when we're trying to help people. We have to make sure we contextualize. We have to make sure we personalize our services. And it needs to change as the time changes as well. So in saying this, it was a very emotional start for us, from the launch, during the research, and even now that it's all done, that we felt like, I do feel like I have achieved something, and we have achieved another step forward into actually improving our service. And we look forward to partnering up more. We look forward to actually building more of these relationships and doing more of these researches, because we know for a fact that it does help, and it will make our work a little bit easier as well. In saying that, we thank you so much for our center in New Zealand, for everyone that has helped us through, and all our partners in New Zealand for sponsoring, for assisting us, supervising us, and also supporting us in every step of the way. It was a big learning curve, not just for me, but also for my staff, and especially now for the participants. So it's building that knowledge, that awareness, and we're so thankful to have been given this opportunity. In saying that, thank you so much. Whawhetai te lava. God bless, and we look forward to connecting with you more. So whāsoifua.
Whakauelahi, Dr. George Tuitama. So Associate Professor Judith McCool is co-lead with Sir Colin and Dr. Rawani. Dr. George Tuitama is the only psychiatrist in Samoa and is the co-investigator for Samoa on this project. Our next two presenters, Saini Jensen, the Director of Performance and Evaluation at Pacifica Futures, and Sam Pilisi, Program Delivery Manager for the Knowledge Hub and Pacific Wayfinders. Pasi mai, and let's give them a big round of applause. Go away.
Mahalo lelei and mahalo apito for the opportunity to talk about the PMA Knowledge Hub here today. The PMA Knowledge Hub is a partnership between the Pacifica Medical Association and the Centre and the University of Auckland, which started in 2021 with a donation from the PMA of $2 million. And we really were looking at the vision of establishing and enabling Pacific people to live longer, better lives in New Zealand and the region. The way in which we want to do that and are setting out to achieve that vision is through four different goals. Firstly, to really build the research capacity and capability of Pacific researchers through developing a cohort of Pacific doctoral, masters and summer studentships, and supporting those through scholarships. Secondly, to develop, to really undertake Pacific-led research and scholarship in Pacific health and social outcomes, and especially taking that holistic, wide view at health in terms of well-being and beyond just focusing on health. Thirdly, there's a real emphasis in looking at workforce best practice for for practitioners, and we've got an exciting development of a university-accredited micro-credential based on the Pacific Whānau Ora model of care, which is coming out in semester 2, and Sam will be talking more about that. And then fourthly, it's around really the partnership with the centre and really developing a centre of excellence to deliver research excellence for Pacific health and social outcomes in New Zealand and the Pacific region. The way in which we're going to do those, we're focusing on 3 kind of main pillars, and Sam will really speak to that and the work that we've done over the last year or so in that area.
Ko whalawhali atu kim tolosi. Thank you, Saini, for sharing, giving us some background information about the partnership that we have, the Centre and PMA. Moving on, unpacking some of the progress made thus far according to our 3 pillars is as follows. So we're really grateful through our biostatistician, Dr. John Sluter, to be working alongside the Manalangi project. Acknowledge some of the team here, so grateful for the opportunity to collaborate and do some great work with our Pacific Rainbow communities. Secondly, I'd just like to spotlight some of the opportunities and what we need to do to provide access for more publications for Pacific researchers, Pacific postgraduate students, for us to tell our stories. One is the Pacific Health Dialogue, and then secondly is a new acquisition of the PMA group, which is the New Zealand Medical Journal. And so what we need to do, which has been elaborated prior to us speaking, is that we need to tell our stories. We need to have that underpinned by our worldviews. We also need to have that accessible to our communities. We need to have that gone through research. These need to be open access, and we need to make sure that our communities know about this research. Secondly, which was alluded to by Saini, we're very grateful and honoured to formally announce today our first 2 doctoral scholarships, of which one is here in person and the other person, I believe, is doing field research in Wellington. So I'd like to formally acknowledge Jess Hutchings, who's in Wellington, and then for Pio, who's here in the audience. Can we give them both a round of applause? So they're both here. I won't shame them and tell them to stand up and wave their hand. It's a bit hard for Jess, who's doing field research in Wellington. But to both of you, we would like to formally acknowledge you properly later in the year when we coincide with the PMA scholarships event. We'll be in touch. But just to round off that part, for FOR's research is exploring the experiences of racism and other forms of discrimination for Samoan cancer patients and their ainga going through cancer care pathways. And then secondly, Jess is looking at achieving equitable health outcomes for Pacific people living with cardiovascular disease in Aotearoa, New Zealand, and exploring the contribution of pharmacists. So again, give them a round of applause, please. We just closed our Masters PMA Knowledge Hub Master Scholarships last week, and so we hope to be later in the year 1 again formally announcing our doctoral scholarships and recognising their achievement, but also announcing and recognising our Masters students later on this year. And what has been mentioned also is we want to provide opportunities and bridging that gap between undergraduate and postgraduate and providing opportunities for studentships. Senior also mentioned a micro-credential, and what's really key for us is acknowledging 2 things. One, we have a large amount of workforce who are hugely competent, awesome in their work, passionate in their service to our communities. A large amount of that social and health service community or workforce is largely low to no qualifications, but we want to recognise that. We want to take a strengths-based approach to acknowledging the awesome work that they do in terms of providing care and advocacy for our Pacific communities. This micro-credential is industry underpinned and backed by industry, and we're really lucky to collaborate with Pacifica Futures on this, and we're looking to deliver this for the first time, which is an innovative project for us to deliver that in semester 2 It is titled Improving Wellbeing Outcomes for Pacific Families. And I think we all can acknowledge that the gateway to wellbeing is through the family, that underpins our identity, underpins our wellbeing, is our connection and our strength in our families. And so we're really grateful for Pacifica Futures for providing the content and the collaboration around that. And we really want to, one, promote the idea of increasing access to higher education for a large amount of our Pacific workforce. Secondly, in terms of service delivery, is we need to acknowledge that there is a large amount of non-Pacific health workforce colleagues that could learn a bit more about our families, understand our worldviews, understand the way in which we do things. And so by sharing information, sharing worldviews, is that we hope to improve the health service delivery of our non-Pacific colleagues out in various workforces. So if you'd like to sign up, come and see me afterwards. Colin might give you a little special for semester 2. And just moving on, in the last pillar for the PMA Knowledge Hub is looking around how we can promote impact, how we can share our stories in wide spaces, be it at events, be it at, in terms of media spaces, be it online, be it through various news stories. And so those are some of the things that the Knowledge Hub has been a part of, particularly so last year. The directors of the PMA group were inducted in terms of to the Sir George Fold Society last year. I'd just like to wrap up, is that we're really grateful for the opportunity that we can collaborate. PMA Group, Pacifica Futures, have an extensive reach into our communities, up and down the country, out into the region, and it's important for us to push research, but it's also important for us to keep our eyes and ears on the ground. And so through this collaboration, we're really grateful for that, for the collaboration to inform what we do, and we look forward to year 2. Thank you very much.
How are we going? Okay, good? Yes, please don't fall asleep on me. Okay, our next speaker, Dr. Aditi Bunker, postdoctoral fellow at University of Heidelberg. Whakalofalahi atu, and let's give Dr. Aditi a big round of applause.
Kia ora, everyone. I'm actually a Kiwi, and I've come back to New Zealand, and very proud of my country. And so I've recently have been working together with Sir Colin and Professor Chris Bullen, Dr. Noah Bunkley, and we were able to write a grant, and we got this grant, and I'm now going to present you a synopsis of the work that we're going to be undertaking. And hopefully this project is going to be a bit of a flagship project under our new centre here. And yeah, we're really looking forward to continuing on with this work. So the theme of this work is really one of the defining issues of our time. And it's associated with some of the floods and the major cyclone events that we've just experienced here in Auckland in the last 3 months. And yep, for anyone that hasn't guessed, it's climate change. And there's also been a bit of talk about how climate change is affecting the Pacifica community. And so this is really what we're aiming to target here with this research. And of the myriad climate change effects that are ongoing, we're going to be focusing on heat in this work. So with global warming, of course, the world is getting hotter. We're experiencing more extreme events. And there's also more erratic events and a prolonging of moderate heat effects. So the question really is, how do we adapt? And through our equity lens, how can we protect the most vulnerable populations? So we really need to provide evidence to policymakers so they know which adaptation strategies to fund and to implement in their communities. So the project that I'm going to be talking to you about today is about a home cooling technology. They're called cool roofs, and we're going to be applying some of the kind of best methodologies to be able to show how these technologies affect health, environmental, and economic outcomes. So we identified 4 climate hotspots around the world, and as you can see there, they're kind of really evenly distributed across the world. We've got a site in Mexico, in Africa, Burkina Faso, in India, and of course in Niue. So this really is a multi-centre analysis and study that we're undertaking in ferociously hot countries, and also where there's underlying issues with heat, such as in Niue across the population. So this is just an overview of the sites that we're going to be working in. And as you can see, they're all pretty, the temperatures across these sites can get usually above 40 degrees. And so we're trying to look at which technologies really work and where and how we can provide evidence to policymakers. They all come from, these countries are in different geographical regions with different housing types. And the technology that we're hoping to apply really try and mitigate these effects. So this is, well, this is, does anyone know how I can activate my video? Oh yeah, here we go. So this is an example of, this is just a drone that we've got flying around Burkina Faso. And this is just capturing the aerial views of what it really looks like in the region. It's dry, it's arid, and it's hot. And basically what we want to do is to conduct a series of 3 studies. The first is to look at engaging with the community to understand their perceptions of heat, and also whether they will accept the uptake of the technologies that we're offering. The second part is to look at the carbon footprint reductions in the population associated with this technology. And the third is to conduct cluster randomized controlled trials where we give half the population the intervention and half not, and then we assess health, environmental, and economic effects. And if we can play again, thank you. So this is the technology. It's a cool roof coating. It's a passive technology for home cooling. So basically, our team here in Burkina Faso are applying the technology to the roof. They're quite economical, very rapid, and fast to apply. They don't have any sort of toxic effects, and they also have waterproofing qualities. So there's evidence to show that there's anywhere between a 1 to 4 degrees Celsius reduction in temperature with the use of this sort of technology. And depending on the roof types and the different geographical constraints, we'll leverage these and be able to use them accordingly in the study. So here we've got mud roofs, and previously we had tin roofs. So you can see that it's quite a versatile technology, and we're able to use it across different populations and different types of housing. And just as soon as the application was done, we found that there was over a 10 degrees Celsius reduction just in the actual roof temperature on the surface. And this is quite promising. And now we're starting to look at how this really affects deep down into the house, how it's going to affect the temperature reductions. And then we'll be sending in our field teams and also looking at how it affects people's health and well-being. And also the carbon footprint reductions and economic outcomes. So if people sleep better under a cool roof, does it mean that they work better, that the children have fewer days off school, etc. So I'd like to take this moment to acknowledge our team here at Auckland Uni, plus all our colleagues. We're the Reflect Consortium, and we have 3 industry partners at the moment that are funding materials across the world for our studies, and we're sponsored by the Wellcome Trust. Thank you very much, and I'm looking forward to working on this project with everyone.
Thank you. We're going to have a 59 seconds break, so if you can please stand up and go and have a chat to your next door neighbour or someone behind you, or go and grab yourself a drink, or go to the bathroom. 59 seconds. Thank you. 58.
going to ditch some of this. I don't need all of this.
For you, 2 seconds. You can stand there and do a floor, you want to do a floor show? Okay. So our next speaker, our next presenter is Dr. Gerard Sonda. Dr. Gerard Sonda, a public health physician and epidemiologist from Pacific Perspectives. He's going to share with us the COVID-19 Surveillance Pacific Project. Let's give him a big pasi-pasi.
Thank you very much, and also thank you to the organization for inviting me to share the findings of the study we did. On the next slide, we evaluated the COVID-19 outbreak in New Zealand, the August 2021, which is a while ago, and especially with a focus on contact tracing. And the title is A Giveaway, We See Delayed Contact Tracing for Pacific People, which has contributed to widening health disparities. I would like to acknowledge the co-authors of the article. It has been published in the International Journal of Infectious Diseases, open access, so you can all find it there. And this may remind you of the outbreak. This was the second day of the first outbreak with the borders closed. We eliminated COVID in the beginning. We were 102 days free of COVID, and this was the first incursion with community spread. We thought in the beginning it was related to a miracle, but later on we did not really find a root cause. And it was most likely that it was escaped in managed facilities. That was the off button. Yeah. So what we did, there's many notifiable diseases in New Zealand, about 50, and COVID was made notifiable, which means every case that is diagnosed has to be notified to the public health unit, and systematic data is collected to learn and also to keep track of the outbreak, which is done in the database Episerve. And when COVID arrived, the Ministry of Health very quickly developed a new database, which was called the NCTS, which was for contact tracing, because around every case of COVID, we did contact tracing to try to get every contact in quarantine to stop spread of the disease. And this is called an epicurve. These are all the cases in the outbreak. In hindsight, we know there were 179 cases in total. It wasn't very big. This is the cases by onset of disease and by ethnic group. You see the green people here are Pacific people, red Maori, and blue are the New Zealand Europeans. And we see here the first case fell ill on about the 30th of July. And then it keeps spreading here onward to the 10th of October, when the first cases were notified, and it became clear that we had community transmission. And very soon after, Auckland moved to alert level 3 to stop spread, to stop movement of people. And then we also see that it worked quite well. It went down until here at the beginning of September, the last case was notified. And then the decision was made in the ministry, like about 10 days later, now we are safe, we go down to level 2. So what we see here is that 60% of the people were Pacific, 25% were Maori, and only less than 10% were New Zealand European. And this is the first inequity, the first outbreak with the borders open. Most cases were New Zealand European from low deprived areas, and these were all people from the high deprived areas. And that is because these people cannot work from home. They work in the lower paid jobs, and that's why they get exposed quicker than other people. We looked at the outcome of disease, and for the 179 cases, but there was a bigger study done later on with the first 1,800 or so cases in New Zealand, and they had more cases, so they could do a better analysis statistically. And what they found, that was after controlling for age and also for pre-existing conditions, we saw that Maori people and also Pacific people had 2.5 and 3 times to also being hospitalized. So when they were infected, they had more chance to be hospitalized. And also there was a modeling study, because infection fatality rate is quite hard to study, because we have all kinds of underlying other things. There is an age difference anyway between ethnicities in life expectancy. So this was a model that estimated the infection fatality rate, how many people died after they were infected. And they could adjust this for age, for ethnicity, and also for relative life expectancy. And here we see it plotted by ethnicity. Maori, the red ones are Pacific here, by age group. And here we see over 40, that Maori people have the highest risk of dying when infected, and then followed by Pacific, and then by the other groups. So Maori and Pacific people had both more chance to be hospitalized and also more chance to die after they've been infected. Contact tracing became really big in the beginning. You probably remember this all from the news. Quick contact tracing was really important to stop the outbreak going. And in the beginning, Ayesha Farrell, before she was a minister, she did a rapid audit of our contact tracing. And she published some recommendations. And she said one reporting requirement was very important, that the proportion of contacts quarantined within 4 days after the index fell ill. So the case becomes ill and then all the contacts are traced and they all have to be contacted within 4 days. More than 80% was the indicator. And the reason is that it slows down online transmission because if you're too late, it already has occurred. Also, she recommended to build this into our contact tracing system so we could evaluate and keep track of it, which is what we examined. We linked all the cases to the contact from the other database. And here we found that 51 of the 179 cases did not have any contacts, which is quite unlikely because most people do have contacts. There were no difference between ethnic groups. There's all kinds of reasons in the system that could have caused this. Maybe contacts are linked to one case while there were more cases. But we cannot find out because it wasn't in the database. Of the 179, there were 128 cases who did have contacts, and altogether they had about 2,500 contacts. These cases that were all traced. And of the contacts, we just saw the cases, 60% were Pacific. It's quite logical that also about half of the contacts were Pacific, followed by 14% Maori and 19% New Zealand European. And this says something about the spread potential of the disease. If it arrives in Pacific people, it also spreads in Pacific people if you don't control it. So they have been most at risk. We looked at the number of contacts per case, and the median Pacific people had 8 contacts, Maori 4 contacts, European 4.5. This was not statistically significant. In this graph, we see the contacts plotted by the ethnicity of the case. So these were the Maori cases, and these were all, every dot is a contact of Maori people. This is the Pacific group, but every dot was a contact of Pacific people. And here we see the days from onset of disease, how quickly the contacts were reached. So this is 10 days after, and the goal was 80% should be under 4 days. There's many dots on top of each other. The Pacific people here have about half of the contacts. And then here we did some statistics on the, to see how the speed of contact tracing had been. This here is the total group of contacts, and we saw that the goal was 80% should have been reached within 96 hours, and we only did 41%. So in total, we only reached half of the speed of contact tracing. But most remarkably was that there was a difference between ethnicities. We saw that this is the New Zealand European group, 61% were traced within 4 days. Maori, 58%, and Pacific people were significantly slower. Only 31% of the Pacific people were traced within 4 days. We split this up in 2 halves. This is the 4 days with notification in the middle because the patients fall ill and then you have to wait till they're diagnosed before they're notified. And only when they're notified, the public health units can contact them. So we looked if there was a difference here, and what we saw, both these 2 days intervals were significantly slower for Pacific people than for the other ethnicities. So we saw Pacific people were slowest contact tracing of all ethnicities. So that brings us to the conclusions. Most cases in this outbreak were Pacific, followed by Maori, and already said this, they're living in highly deprived areas, which was in contrast with the first outbreak with the borders open, and most European people living in the least deprived areas. Pacific cases had the highest number of contacts, although not significant. However, only contacts that were reached on the phone were registered. And we know from practice that many people cannot be reached. They don't answer the phone. There are wrong numbers, so there was no correction here. So there could be also an extra difference between ethnic groups of how many could be reached. Pacific people were significantly slower contact trace. And here the conclusion was in line with this article of Stein, what they already found. that when large numbers of contacts are expected in certain populations, and it had been predicted that the biggest outbreak potential was in South Auckland among Pacific people, what you need is you need disproportionate number of contact tracers to deal with the fact. So apparently this was also recommended to the government, but it was not implemented yet. We did not have enough capacity to trace all the contacts for Pacific people. And then my final slide, if I can make it work. Yeah, there was also missing data in NCTS. NCTS was built while the outbreak was going, and it was really great to build the plane as we fly, but it also has some disadvantages, because if you have to act very quickly, the last thing on the agenda is equity usually. You just do what is good for the whole population, and equity was not included. We did not have data on preferred language, we did not have household sizes, and also we did not have data on the people who could not be reached. So we could not conclude from this data why it was that Pacific people were traced slower than other ethnicities. That was not in the data. And I found in Te Pautoko, the interim New Zealand health plan, a really good text. This is under attention now of the New Zealand health reforms, to implement a national consistent system of data capture, analysis and intelligence that supports the use of health intelligence and insights to ensure equity of access and outcomes from all health services across Aotearoa. This is exactly what we need in the future to do that correctly. And the Ministry of Pacific Peoples, they took for their long-time inside briefing, which is a 3-yearly report they're doing. They took improving ethnic appropriate data for Pacific people collection into their long-time inside briefing. So we should collect appropriate data for Pacific people to learn from the future. And I think eventually we should prepare better for future pandemics and outbreaks, and we should include Pacific equity in the preparation plans and in the outbreak plans so it won't be forgotten the next time. That was it. Thank you very much.
Whakawelahi o Itulo, Dr. Gerard Sonda. On to our second to last speaker for this afternoon. Let me introduce you to Dr. Audrey Aumua, Chief Executive Officer of the Fred Hallows Foundation, New Zealand. Pasi pasi mai.
Nimbola vinaka, tālofalava, whakalofala yatu. Afternoon, everyone. And I'm really impressed Colin has sat quietly and calmly for 2.5 hours. Good job, Colin. I couldn't help, just while sitting in the front, just reflect on the significance of today. And I couldn't but think about, 35, 40 years ago when we first started out the journey of Pacific Health. Colin and Boyd both had hair, but you did, I'm sure Boyd had hair. But I think about people like Sitaliki Finau, Leo Pino Foliaki, and Se Messi Maiai, and I think about those adventuresome days when we really had to work a whole lot hard. And I think in this room there are probably a ton of Pacific PhDs, and this is no small milestone, so I really want to acknowledge you, Colin, you, Boyd, in particular. There is Judith, who spent half her career supporting Pacific graduates through this journey, and of course, Rowena, all of you who have made today happen. Fantastic, and I thank all of you. I'm sure our colleagues from 35 years ago are dancing in the next world, because this is a fantastic milestone. Kia ora, Himi, thank you for your welcoming words. I work in avoidable blindness. And hello. And so we really wanted to share with you. We're incredibly proud, actually, Colin, to be in this partnership with you. It's in an area that is completely unknown in our region. It is an international project. It is a 5-year project. And it really is about exploring what really is the burden of avoidable blindness in the Pacific. There's very little data on this issue. There's very little data on the actual status of blindness in our region, and many of you will have someone in your family, whether here or in the Pacific, that has a condition around sight. And I can't think that over the next 5 to 10 years, as we, as a region and as a population of Pacific people, start to deal with some of the challenges around non-communicable diseases and diabetes, this emerging threat of diabetic retinopathy that is going to cause permanent eye damage will be challenging for us as a community. So the purpose, I'm going to talk about, why we're here, but Nimisha's really the researcher, along with Jackie Ramke from the School of Optometry and Vision here at Auckland University, is going to talk a little bit more about the methodology. But really just to say, I'm supposed to operate this, aren't I? Is that right? Yeah. This project is called the State of Eye Health in the Pacific. And it's a research project, and as I said, it's entirely focused on the region. It is going to explore what is the burden of eye health, and in particular, its overall goal is to develop evidence and develop information for those who are making decisions in our health systems related to eye care. And the work of Fred Hollows over the last 20 years has really been to build the eye care workforce. We have been really proud to being a partner in the region for the last 20 years, where we have trained more than 350 eye care workers. 35 of them are ophthalmologists, actually, and they stay in their countries, they work in their countries, and they help their governments develop eye care services. But what we haven't done well enough in the past decade or so is really build baseline knowledge and information and evidence about what really is the burden. So this project is really about that. More specifically, let me say, there's a couple of research program objectives. And, our countries and our decision makers in our region are often challenged with so many priorities. Where do they spend their money? If they've got $5, where does it go? There's so many competing priorities. And eye health is not a real priority in our system because we don't know enough about it. We don't know, what the evidence looks like. We don't know what the level of burden is. But my ophthalmologists, my eye care teams will tell us that, they are constantly seeing hundreds of patients with cataracts. They're seeing lots of conditions around refractive error. And more we are beginning to understand the burden of diabetic retinopathy. And so what we want to be able to do is to share with our governments and our partners really what is the evidence so that decision-making is more improved, investments are better targeted. And we hope this is the project that's going to help us do that a lot more. Some of the outcomes, of course, and I know we've been talking about research capacity today, but definitely one of the key outcomes of this project is not only about improved information, baseline evidence, and understanding the reality of the burden in these countries, but it is primarily equally important that we're going to build research capacity. We don't do anything with our countries without them, and this is a really important aspect of the work. So we are thinking about baselines, we're thinking about more evidence, but we're also taking and growing that research workforce. I will hand to Nimisha to talk a little bit more sensibly about the research methodology for all you researchers. Thank you.
Great. Thank you, Audrey. Kia ora koutou. I'm Nimisha. I'm Information and Research Advisor at the Fred Hollows Foundation. So as Audrey has mentioned, I'll give a bit more detail as to how exactly we will be delivering the program. So the program is split into 3 main phases, starting in 2023, this year, and completing in 2027. So the first phase, a situational analysis, seeks to understand what is the current eye health situation across the Pacific. This includes understanding prevalence and causes of vision impairment and blindness, as well as understanding the functionality, capacity, and performance of eye health systems across the region. And then we'll use this information to advocate and lobby to Pacific decision makers and governments on the importance of including eye health and health system strengthening efforts. Then this leads to the second phase, which focuses on gathering the evidence required to create eye health plans and policies to achieve integrated people-centered eye care, and then to also understand what are the local and contextual priorities of our Pacific partners in eye health system strengthening. And then finally, this leads to the final phase, which is focused on creating an action plan and providing recommendations to Pacific decision makers on how to achieve universal health coverage for eye care. And it's very important for us that in each phase and each activity we conduct, our Pacific partners and our Pacific eye care clinicians are involved in every activity. And specifically, each phase will be guided by local leadership and country priorities, strengthen local capabilities, voice, and agency, and consider the impacts of blindness and vision impairment on disadvantaged and marginalized communities. Then, to give a bit more detail on our first phase and the studies we'll be conducting in this. So over the next 18 months, in collaboration with the university and our Pacific partners, we will be working on rapid assessments of avoidable blindness in Vanuatu, Fiji, and Samoa to understand the prevalence and causes of vision impairment and blindness across the region. And then following this, we'll be conducting a systematic scoping review to understand what information has already been published on eye health and by whom, as well as to avoid any duplication through our program. And then following this is a baseline situational analysis using the World Health Organization tools from the Guide for Action to understand the capacity and performance of eye health systems across the region. And then finally, using the information collected from the prevalence studies and from the baseline situational analysis, we'll be conducting health economic analysis to understand the provider and societal cost of vision impairment. And for us, the key central part of this program and the success of this program is our partners. So I'll hand back to Audrey to discuss our partnerships.
Thanks, Amisha. It's, I know for those of you who work in Pacific Health in New Zealand, the question might be, you know, what are we doing in New Zealand? And the burden of avoidable blindness on our Pacific communities in New Zealand is likely to be significant. And I know we're about to go out and do some really important surveys in the region, but the question could be asked, why hasn't New Zealand done this? And you can ask Jackie later. But, you know, the interesting thing is that we've never done that kind of work in New Zealand or done it sufficiently enough that we understand that burden. So I don't know if the Fred Hollows Foundation has enough resources to do that, but there you go. Look, one of the most significant parts of this project is our partnerships, and this entire platform of this work is about partnerships, whether it's with Auckland University and with others. But we have been training ophthalmologists and eye care nurses in the region for 20 years. The Fiji National University and the Divine Word University of Papua New Guinea are really our key training partners. So we intend to keep working with them and training, using nurses to train and research. We're of course working with WHO, and of course the International Association of Preventable Blindness is a key partner for us, SPC and PAC Eyes. And many of you may not have heard of PAC Eyes, but it is a regional consortium of all eye care workers in the region. So these are the partners that are going to help us ask these big questions, collect this evidence so that we can support our governments in the Pacific to make more improved decision-making around the long-term future of eye health for Pacific people. Vinaka, thank you for your time.
Vinaka Vakalevu. Now to our final speaker. Sorry. I'd like to introduce to you Dr. Judith McCool, who's an associate professor, is head of School of Population Health at the Auckland University and co-director of Te Poutoko Ora a Kiwa, Centre for Pacific and Global Health. Judith brings experience in global health, including a special and specific interest in teaching and decolonising global health systems. Pasi mai ke latai mo Dr. Judith McCool.
No dance is too late, Colin. That's for sure. Maloa pito, me taki mata, whawhatai lava, vanaka, whakawai. Whakawhatai lahi lehi, leli. Whakawhatai lasi, na mihi nui, and thank you. It's been an absolute pleasure. This has been the culmination of so much work, and we're really delighted to welcome everyone here this afternoon. to celebrate the launch of Te Poutoko Ora e Kiwa. It's been a long time in the making. This started some time ago, really. Conversations at various events, conversations with colleagues across the faculty, thinking about how we can turn what has been an idea, a nice thought, into reality. We at the University of Auckland really pride ourselves in being, in some ways, the heart of the Pacific, the home for Pacific scholars and communities. But yet we lacked something that helps pull this together and really give focus and emphasis to the work that's going on. So yes, this did start in a very sort of earnest and somewhat feverish way about a year or so ago when we started to put together a proposal with Dr. Roani and Sir Colin and many others in the room here. But it did start some time ago, and I know the acknowledgement of others who've worked in Pacific Health for some time. So really, one of the things I want to mention is looking back over the letters of support, and we did receive many letters of support from colleagues around the region, across New Zealand. Several words kept coming up, which I think are important to remind us about today. There was the reference to the timeliness of the proposal, in particular because the proposal was sought at a time just post or emerging out of the COVID-19 pandemic. And there was an acute recognition that the impact of COVID-19 had overwhelmed health systems, not just here in Aotearoa, but in our region. And that climate change was a reality that only served to undermine the well-being and security of populations. All letters of support in various ways referred to the value of strong partnerships and collaboration as the way forward, and the need for research-based evidence led by Pacific people, and therefore the urgent need for to grow a Pacific workforce and leadership. And we see this in terms of the centre through an inclusive approach, adaptable training opportunities for scholars and collaborators alike. So it does take time, but it takes the right people, good timing, and dogged determination to translate a vision into reality. We firmly believe that actually in the future it will be the global north, as it referred to, that will be looking to us in the south for guidance and wisdom on how to make decisions, of how to use resources wisely, how to put equity at the forefront of everything that we do. And it will be led by our Pacific and indigenous scholars and collaborators. So finally, I just want to thank the many people who've been involved in bringing this event together. And of course, I'd like to acknowledge Nalei Taufa, who has Sam Palisi and Grace Shaw in particular. They have worked incredibly hard to pull this together. As you can imagine, this is no small feat. It's a huge amount of work. I acknowledge all of our speakers, our distinguished guests who have made the time to come and join us today, and those who are online. I know that Sir Ashley is watching from Geneva right now, and there's many others around the region. I acknowledge former Prime Minister Jacinda Ardern, who was so enthusiastic about joining us this afternoon, and really just couldn't be here due to family reasons. Clark is away and she's solo parenting, and we appreciate the challenges there. I just also want to acknowledge working with Dr. Roani and Sir Colin in this process. It's been incredibly enjoyable. I've learned so much. I value the collegial relationships we've built, just not with each other, but also in our wider networks. I acknowledge all our colleagues who have pitched into the formation of this proposal that got us to this point. And we value the trust you put in us to bring it to the stage where we've built a firm foundation and we can take it forward. And I really value also the colleagues across the university and other areas that often aren't mentioned, the research support teams and others who really help and are right there when we need them to ensure, in most cases, that it goes smoothly. So I think this is really a collective effort. So thank you everyone for joining us to celebrate this really important occasion for a really significant event. Tēnā koutou, tēnā koutou, tēnā koutou, katoa.
Thank you, Dr. Judith McCall. Okay, so we have come to the final performance. So the school that you're going to see the performance is Favona Primary School. This school is the very first bilingual unit school in the world. And I have to acknowledge also the ngahua that Sir Colin Tukuitonga helped with the launch, with the blessing, and with all the paperwork and the meetings and community consultation for the establishment of Favona Primary School, Niue Bilingual Unit. So the name of the unit is called Manakolahi Mokoina Ke He Wangahau Niue. And it's very, it's emotional, but it's a time to celebrate and also acknowledge the many work that our Pacific educators have done. So introducing Manakolahi Mokoina Ke He Wangahau Niue. Pasi mai, kalanga mai! Well done. I just want to also acknowledge my staff, Derek, Sheila, Joy, Elder Sadaraka, and also our matua for Malama, for all the work that they do. And again, yeah, the best, the only newer bilingual unit in the world, and the one and only. But we are looking at opening up a new one, but please, yeah, we want to grow the Wangahau Niue because UNESCO has identified it as an endangered language. So, kai whakauelahi mahaki, hai au lilifu ke tuku atu, wina atu ke he hatautolo a vika matua whakawhikau Reverend Inga sia mokole ke hake mai ke pā mai whakau si hatautolo a taonanga nei ke he liongi, pia foki, ma lilifu Sir Colin ke whakamuina foki domina kai, po ke hahewi mai, so I just want to invite our Reverend Inga Mokule to come and bless the food and also to end our launch of Te Poutoko Ora a Kiwa. Whakawe.
Monu, Center for Pacific and Global Health. Hosha! Tukwesora, Moyo. Monu, Monu, Tukwesora, Moitotor, Kitu, Kitu, Kituea. May the peace of God, which passes all understanding, keep your hearts and minds in the knowledge and the love of God. In the name of the Father, and of the Son, and of the Holy Spirit. Lord, we're just about to partake with our food this afternoon. May you bless those who prepared, and may you bless our evening, and may you bless our journey forward. In your holy name we pray. Amen. And may you enjoy your
There we go. Thank you very much for Kawelahi Mahaki Oi Tulutulo. Everyone, please make your way to the table on my left for some light snacks on your drive home, sitting in traffic. For Kawelahi. God bless. Just a friendly reminder, please, no food, no menakai allowed on the white tiles outside. Just on the far left, please. Thank you.
Actually mapped out. We only need like 4 cards to do one. That's what a box. And I just start feeling
Oh, I'm on the run, the highway is my own. Guess what? Oh, no, 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 no.
Hey, what's cool? It's your boy King Sam. Cookie vibes, they swap. Hey!
I like to settle down, but they won't let me. Oh, I'm on the run, the highway is my own. Say, but I sing down every corner, there is always one more city. Said I'm a fugitive, it must be a rolling stone. But I sing it again, I say down every corner, there is always one more city.